The Department of Health has launched its COVID-19 vaccine certificate portal. It allows users to create a QR code showing their COVID-19 vaccination status. Professor Barry Schoub is the chair of the Ministerial Advisory Committee on COVID-19 vaccines, and he joins us this morning. A pleasure to be in your company this morning, Professor Schoub. So let's start with a bit of context. What is this about and how will it work?
Yes, good morning, Ndudu. Yeah, basically it's a way of certifying that you have been vaccinated. So up to now, we had these just the cards, and the problem with the cards, of course, they can be duplicated, they can be forged. So this is going to be a digitized version of that. At the moment, the first phase will just be simply a digitized version of your card. But over the period of the next couple of weeks, there will be improved, there will be a QR code, and it will be, the security will be increased as well. So there will be a higher security digitized certification that one has been vaccinated.
Right.
And then, of course, it's got a lot of use for various reasons.
Please expand on those reasons.
Well, look, the obvious one's international travel, because many countries, of course, demand a certification that a person has been vaccinated. So that's the first one. And then, of course, there are locally as well various situations where one needs to kind of verify and authenticate that one has been vaccinated. For example, attending certain venues, attending certain functions, being admitted to certain functions, where there is a risk, a greater risk of virus transmission. And there are really wants to ensure that people attending these venues does have certification that they have been vaccinated.
We'll get into that in a moment, please. I'm curious, though, to find out what some of the considerations were that were made when digitizing this, especially when we consider smartphone penetration in that country, that we're not at levels where we desire to be.
No, this is one of the drawbacks, of course, that many of our population don't have smartphones. But, you know, these things can be printed off, and one can have a hard copy of the print with a QR code. So those individuals that don't have a smartphone could still access the digitized version and have a hard copy printed off.
On the reason that you had given us in terms of venues and functions for people to get vaccinated rather before they can attend these functions, and on the assumption that, you know, venues like stadiums will be open as we go along, what do you say to somebody that says, well, are you not dangling a carrot in front of people and essentially compelling them, because we do know that there's a lot of vaccine hesitancy in the country? Your response?
Well, you know, I think my response is this, that, you know, I've got the choice myself to be vaccinated or not to be vaccinated. And then I've got the choice that I want to have verification of that vaccination status. And I think it's a kind of, I don't quite follow the logic that somebody else wants to impose on me that I shouldn't have the right to be vaccinated or shouldn't have the right to have that being verified. These are still choices. The choice is still there whether to be vaccinated or not. Of course, there are consequences if one doesn't get vaccinated, but one has to remember that being vaccinated doesn't only protect oneself, you're protecting other people that you're coming into contact with as well.
The target, as we heard from the Health Minister, Dr. 70% of the population being inoculated or immunized by the end of this year. Are we well on track to achieve that target just from the work that you do? Do you perceive we are?
Yeah, I do. This is a difficult one to really answer. You know, as you know, we have flagged off a bit in terms of our vaccine coverage. But we're hoping that with the accelerated weekend vaccinations, we're going to make up that leeway. But yes, it is a challenge. We do need to get, I think the state president had it calculated for him that we need 250,000 per work day, per day during the week, during the working week, 250,000. So we're not there yet. I mean, the last 24 hours we were just over 200,000. So we do have a gap to fill. I do hope that we will get to that. I think it is a reasonable target. I think we can get to it. but it will require quite a bit of effort.
Do you perceive that perhaps messaging needs to change in some way? I hear what you are saying about a personal decision being made and protecting the next person. But given that some people are also worried about the long-term effects of the vaccine, do you perceive that perhaps the way the way government has messaged the issue of vaccination needs to change?
Yeah, I think this is a very important issue. I think that the communication package needs to be tailored to the community. We need to have what we call trusted communicators, communicators who are going to take that message, and that message is a very, very clear message. It's a very authenticated message, it's a very scientifically evidence-based message. But that needs to be appropriately packaged and taken to all sections of our community. So we need trusted communicators and trusted communication mechanisms to get it to all sections of our population. It is an easy message to take across, and we do need to kind of convince people that are hesitant, that are nervous, that these are very safe vaccines, there are no long-term effects, and they're very effective vaccines.
Are you at liberty to share with us what sort of conversations are happening around the Sputnik vaccine for South Africa, and perhaps remind us what vaccines are in circulation in the country?
Well, the vaccines that are in circulation in the country are two, the Pfizer vaccine and the Johnson & Johnson vaccine. Those are the two vaccines which have been registered by a health regulatory authority, SAHPRA. In addition, the AstraZeneca has also been regulated, has also been approved. It was approved, and it can easily be put back onto approval. But at the moment, what's we're using are the two vaccines, the Pfizer and the Johnson & Johnson. Those are two vaccines. Other vaccines haven't as yet been approved by the regulatory authority, and there are various issues or various kind of bits of information that we still need to acquire, for example, from the Sputnik vaccine, and also from other vaccines as well. But at the moment, we do have adequate supply. We're not constrained in terms of our supply of the two premium vaccines, the Pfizer and the Johnson & Johnson, which are internationally recognized by just about all countries throughout the world.
Right. Perhaps in ending the conversation, your reaction to the United Kingdom removing South Africa from its red list?
Yeah, of course, we're very delighted. We met with the authorities, with the scientific authorities, and we convinced them that really their worry was that there may well still be the beta variant circulating. We convinced them we have such a rigorous monitoring system for genomic surveillance that we can be very well assured that we don't have beta anymore. And it's very welcome news that we're off the red list, and that they will be recognizing our vaccines as well.
Professor Barish, thank you very much for your time this morning. He's the chairperson of the Ministerial Advisory Committee on COVID-19 vaccines.